24 minutes after the hour. For 2 nights in a row, comedian Jimmy Kimmel has used his monologue to take aim at the GOP's latest effort to repeal Obamacare.
They're not taking care of you. They're taking care of the people who give them money, like insurance companies. Most of the Congress people who vote on this bill probably won't even read it. It is, by many accounts, the worst health care bill yet.
But is Jimmy Kimmel have it right? Is he speaking the truth when even Democrats aren't even coming out and criticizing it to that level yet? Just ask Michael Needham. He's the CEO of Heritage Action, the Heritage Action for America Committee. So you see a lot of criticisms here, Michael, on a plan that's kind of snuck up on us. But is Jimmy Kimmel right? The pre-existing conditions, which he went on to say that this plan does not does not care for, do indeed states have the rights to not take care of those with pre-existing conditions?
They don't, actually. What Section 106 of the bill says is that every single state has to make sure that there continues to be affordable access for people with pre-existing conditions. The entire thing is kind of what's wrong with the way we talk about policy in this country. I'm sure Jimmy Kimmel's a nice guy. I'm sure he's very well-intentioned. But he's both wrong on what this bill does, and he doesn't understand there's a whole bunch of conservative ideas as to how we can take care of people with pre-existing conditions. They're different from how Obamacare does it. That doesn't mean that they're wrong, and it doesn't mean that people like Senator Cassidy who support them are liars. And for this country to always kind of elevate everything to, you know, who's lying and who's not is why people get sick of the way we talk about policy.
He also pointed out the AMA, the ARP are against this. All the medical organizations are against this.
Yeah, well, as he said, you know, the status quo is in favor of Obamacare, but the AMA was in favor of Obamacare. Obamacare has been a complete and utter disaster, and so I don't think we want to give the AMA, you know, the only voice in this process. We should have a fact-based debate. Jimmy Kimmel does not understand how conservatives want to, in a compassionate way, take care of people with pre-existing conditions. If he wants to get educated, he should come by the Heritage Foundation. We'll do a private briefing for him, and he can learn the other side of this debate. He doesn't understand it, and now he's slandering people who support it.
But are you saying that if you're somebody of, let's say, of middle class, $75,000, and your kid has a pre-existing heart condition and needs life-saving surgery, like Jimmy Kimmel's son, and thankfully it worked, and he's got to have more follow-ups, much similar to Brett Baer's son, you're saying that they will be taken care of?
We are the richest, most compassionate nation in the history of the world. We will make sure that everybody gets taken care of. There are different ways to do it. And Jimmy Kimmel should spend the time, if he wants to start acting like a healthcare expert, to understand how different people of good intentions would solve these problems in different ways. We're happy to play a role in helping him to get educated.
Joan Walker of Georgetown University Hospital says this: the Graham-Cassidy bill, like the previous Senate repeal in place, takes a fiscal crowbar to Medicaid's knees. Is she accurate?
Well, look, I mean, what Obama did is he expanded Medicaid, which was supposed to be a very focused program on people with disabilities, and vastly expanded it to able-bodied people. And that is something that's a problem with that program. What the Graham-Cassidy bill ultimately does is it takes power away from Washington, D.C. It says we're not going to have every decision made in the federal Capitol and allow states to innovate. And I think that's something that all Americans, Republicans and Democrats, should support, because everybody is sick of these high-stakes debates where everyone ends up yelling at each other, everyone ends up calling each other liars. Let's let states which are closer to people, which can have different approaches to doing things, experiment and de-escalate politics so Americans don't get as frustrated as they are.
And we're going to talk to Senator Cassidy in just a little while. Like we talked to Senator Graham yesterday, try to get the facts out and see if any changes will be made, because then it's got to go to the House and conference, and things will be changed then. Chris Christie, Republican governor, came out yesterday and says, I'm opposing this because it's going to give New Jersey $4 billion less.
Yeah, look, Obamacare, and even before Obamacare, has given more money to Northeast liberal states, which have expanded Medicaid. What this bill does is it tries to bring parity on a per-person basis between states. So the amount of money spent by the federal government given to the states on a per-person basis will become closer to parity. That's bad for New Jersey because they've been winners of the past system, but it's closer to fairness, which is where we should be moving.
Michael, from what you could say, does it touch pharmaceutical costs, which are a main problem?
You know, I'm not sure about that one, but what it does is it allows states to experiment, and we need more experimentation, so some of these problems can be looked at from different vantage points and with different angles.
And I know, you know, you're a conservative, that's what Heritage is. When Rand Paul comes out and says, hey, I said I was going to repeal and replace, this just continues it because so many of the Obamacare taxes remain in it. What do you say?
Yeah, there's no doubt that this bill does not fully repeal and replace Obamacare. There's no doubt the Republican Party ran on that for 7 years, and they weren't honest when they said that. This bill is a bill that does a lot of good things. There's some problems in it that need to be addressed. We had a great meeting with Senator Cassidy yesterday trying to fix some of those aspects that need to be fixed. But this is the bill that's before us, and Senator Paul's right. It doesn't repeal and replace.
So you agree with his vote?
I think that everyone needs to look at this. I think that there are some small changes, specifically to options 3, 6, and 7 of the 7 options people could have that need to be made to make this bill better. But that's the environment that needs to be looked at.
And finally, from your contacts in Washington, Murkowski, McCain, Collins, Rand Paul, who is in, who's out?
Well, Rand Paul seems pretty clear that he's going to be out. Lisa Murkowski doesn't exactly work closest with the Heritage Foundation of anybody, but I think you're going to see either Murkowski or McCain as the 2 most likely to come around and vote for this bill.
To come around and vote for it.
I think if somebody does, it's probably going to be one of those
And
two.
Dan Sullivan yesterday of Alaska, and maybe there'll be some, I know you're not going to like this, some type of Cornhusker kickback for Alaska.
Oh, it seems very clear Alaska's going to do well when this is all said and done.
All right, Michael Needham, thanks so much. We'll continue to unfold this. And